Well, thank you very much, Mr. Chairman. Dr. Collins, thank you to you and all of your team for being here today. We appreciate all that you do to champion the critical work of NIH. You've been a great partner and really appreciate your leadership and all your teams. And I, too, welcome Ms. Bacchini. It's good to see you again out from Montana. And I look forward to having a discussion today about really the devastating impact that President Trump's budget would have on NIH. As you all know, President Trump has proposed cutting NIH by 22%, most of it by arbitrarily capping indirect costs, resulting in the lowest funding level for biomedical research since 2002. 3 months after releasing this proposal, we still do not have basic information from the administration about how NIH would implement a $7.5 billion reduction without severe consequences for thousands of research facilities and tens of thousands of scientists that rely on its grants to support their work. Facilities like Fred Hutchinson Institute in my home state of Washington, just to cite one example, where scientists have pioneered bone marrow transplants and today are searching for cures to cancer and an HIV vaccine. But because of this proposal, could be forced to dramatically scale back their efforts to develop cures for patients. So these cuts are deeply concerning, which is why I've said repeatedly, I really hope that both parties will once again reject President Trump's budget proposal and continue to work together as we have to ensure NIH is able to carry out its vital work that gives hope to those living with chronic and life-threatening disease and bolster economic growth and competitiveness. But before this discussion can happen, however, I have to note that today's hearing takes place in the midst of a very pivotal moment for our healthcare system as a whole. As we have heard all week, our Republican colleagues appear to be dead set on jamming their version of Trumpcare through the Senate in just a matter of days. This is a bill that has been subject to no hearings, no public debate, and no expert testimony. It's a bill so secret that apparently until just moments ago, many Republican senators were telling press and constituents they couldn't say what was in the bill. It was a bill so secret even President Trump's top health care advisor, Secretary of Human and Health Services, told us last week that he didn't know what was in it. It has been so secret and closely guarded that not even the 13 male senators who made up the so-called working group could comment with certainty on what was in that or when it would be brought up or by what procedure. And in fact, it's a bill so secret that even the White House press secretary couldn't confirm whether President Trump, or anybody in the White House for that matter, had seen the bill, which begs the question, as I have said this week, what are Republican leaders so ashamed of? Well, it is becoming very clear now that those who wrote the Trumpcare bill knew they wouldn't be able to go back home and defend it because based on what we are now learning, this bill is going to be the same kind of Trumpcare bill that went in the House, and it will have tremendous impact on patients and families. Higher costs for families, especially seniors and people with pre-existing conditions. Insurance companies no longer will be required to cover basic health care like maternity care or mental health services and more. Women would lose access to their doctors and to the care they need at Planned Parenthood, and tens of millions of people across the country would see their Medicaid coverage taken away. That means people nationwide who are finally getting treatment for substance use disorders like opioid addiction or mental health care or access to a primary care doctor under Medicaid are going to lose that access. So as many of my Democratic colleagues have said, this is not a health care bill, it's an attack on families' health and financial security. So again, I just want to reiterate my message to Republican leadership. It is not too late to dump this Trumpcare bill. It's not too late to make the right choices and work with us as Democrats to fix our healthcare system. As the chairman and others on this committee should know by now, Democrats stand ready, as we always have, to work together to actually make healthcare more affordable and accessible for patients and families across the country. But we cannot begin that conversation until Republican leadership reverses course. And lastly, I do have to say that after hearing this week about so many of my Republican colleagues feeling frustrated about this bill's process, who are angered about being shut out of this process or receiving conflicting information, or who may be even shocked at the text that was just released, well, you have the power to do something about it, not just to complain. You can insist on full hearings, open debate, increased transparency, because let's be very clear, people across the country are really worried about the approach that's being taken. They're watching, they're going to be paying close attention, and we need to get this right, not what is being jammed through the Senate. And with that, Mr. Chairman, I'll turn it back to you.